Hi everyone, I am Dr. Batul, a family doctor practicing in Melbourne. Welcome to my channel here where we talk all about healthy lifestyle and health education in simple way. Today's video is very important because I get this question all the time. So you walk into my clinic and say, Dr. Batul, I want to lose weight. I have tried everything. So today I will tell you exactly what happens when you come to my room asking about weight loss, what I check for medically, and how we build a plan that actually works. The first thing we usually do as doctors is listen and take a history from you because weight gain is rarely just about food. So I might ask you things like, what have you tried before? What diets have you tried? Have you tried ketos? How often do you go to the gym? Have you used any medications before? When did the weight gain started? After pregnancy, after stress, after an injury? How is your daily routine like? Do you struggle with any craving or emotional eating? What is your activity level is like right now? How's your sleep and are you under any stress? What's happening in your life? Working, family, finances, and most importantly, what's your goal? Is that just for weight loss or for better energy, better health, fertility, diabetes preventions? Because I want you to understand this weight gain is usually not just about willpower. Your body has reasons for holding onto fat. That could means hormones, stress, metabolism, certain medications, and mental health. And before we just jump into weight loss or weight loss plan, we usually screen for any eating disorders because eating disorders are usually under-recognized and many people feel embarrassed to talk about them. Because if an eating disorder is suspected, giving you weight loss advice can actually worsen the problem. So in that case, we usually change the plan, we protect your mental health, we treat it safely first, and we focus on your health. Now then we start looking at your health properly because weight is connected to many medical conditions. So we ask questions about and screen for anything like type 2 diabetes, pre-diabetic, PCOS, and obesity-related infertility concerns, whether there is any fatty liver disease, whether there is any obstructive sleep apnea, whether there is any obesity-related cardiomyopathies, any hypertension, any high cholesterol, stroke risks, and we also ask about risk factors. What we check usually for is smoking, family history of obesity, reduced mobility, thyroid disease, menopausal or perimenopausal. Sometimes we also ask about medications because certain medications can cause weight gain such as antipsychotics, oral steroids, and sometimes adjusting medications safely makes weight loss much easier. After taking a history, we then do an examination in here where I will check your height, weight, waist circumference, and blood pressure and heart rate, and then we do a BMI calculation. Depending on your situation, I might request a blood test, and that's to see if there's any underlying thyroid problems, Cushing's, nutritional deficiencies, and screening for diabetes and cholesterol. Common tests include, as I said before, thyroid function, cholesterol, diabetes, iron, B12, folate, vitamin D, because if you are tired, deficient, or hormonal imbalance, weight loss becomes much harder. So we try to fix the problem that's blocking your progress. Then I explain expectation clearly. Sustaining weight loss is not fast, but it's slow and steady. We really aim for realistic goals such as half to 1 kilogram loss per week. Even a modest weight loss of around 5% can reduce risk of cardiovascular risks, prevent or delays diabetes, improves quality of life, mood, self-esteem, and improves chronic kidney disease and reduces reflux and joint pain, which is very important. After assessment, we usually create a personalized plan together. In that case, we set on SMART goals that are specific, measurable, achievable, relevant, time-based. For example, I will walk briskly for 20 minutes, 5 days a week, and review after 1 month. We focus on realistic goals, and here's where I might refer you to a dietitian for a nutritional plan, but we also discuss general guidelines such as focus on proteins, more colorful and green vegetables, some fruits, regular meals that are smaller, Breakfast, even if it's just simple, smaller plates, more water, and reduce soft drinks such as juice, alcohol. And we usually, if we need to, we refer to a physiotherapist, but we also discuss that we aim for 150 to 300 minutes moderate activity or 75 to 150 minutes vigorous activity. We also aim for muscle strengthening to 2 days per week. We also discuss about reducing sedentary time like long sitting and screen time. And as I said before, if I need to, we will have a discussion about referring to a physiotherapist. If lifestyle isn't enough, or if your BMI is more than 30, or if your BMI is more than 27 with comorbidities, or lifestyle changes where unsuccessful or weight gain happens, then we might consider interventions such as very low energy diet with a dietitian support, obviously, and pharmacological therapies, or referring you to a specialist when appropriate. So I get this question all the time about weight loss medications. Look, I usually say they are like the icing on the cake. You still need to put the work in and do your best, but they usually work with lifestyle, and they only work while you take them. And you probably all heard about Wegovy, Mounjaro, Saxenda, and Ozempic. They're all GLP receptor agonists, and they work by suppressing your appetite, increasing satiety, delays gastric emptying, and reduce glucose absorption. They are usually administered once a week. And look, with anything we give, there are the expected side effects. The side effect could include nausea, stomach upset, vomiting, constipation, or diarrhea. We usually don't give it if you're pregnant, or history of pancreatitis, or if you have medullary thyroid cancer. Usually there are other oral medications like oral stat, Contriva, or Duromide, but a lot of people now opting for the injectables because they have been seen to be more effective compared to the orals. As I said, there is Duromide, which is a short-term medication only, but it may increase blood pressure. The other thing we might consider if we need to is refer you for a specialist for surgery. It's not for everyone, but for some patients it can save their lives. And this is the most important part, that weight loss is not only a one visit treatment. Follow-up is really important, and usually looks like every 2 weeks for the first 3 months, or every 4 weeks for the first 6 months. And we have an ongoing support together. We discuss how you're going with your progress, whether you're having any medications, if we started you on anything, monitoring your diabetes and heart risk, and adjusting the plan if needed, because it's always expected that you might have weight gain. Is common, and it's not a failure on you. That's because the body increases hunger hormones, so plan for it early. So I want you to know, if you come to my clinic or for any doctor's clinic for weight loss, that's what happened. We listen, we take a history, we do a physical examination, we might check for blood tests when needed, and we create a personalized plan together. And remember, follow-up is the key, because lifestyle weight loss is not a punishment. It's working with your body and not against it. So if you like this video, hit the like button, subscribe, and share, and I'll see you in the next video.